welcome to Little Learners. In today's video I'm going to be talking about autism spectrum disorder and particularly autism in young children. Before we get started, don't forget to click the like button if you find this video interesting or helpful, as it really helps out the channel, and click the subscribe button so you can see more videos just like this. So I think one of the questions I get asked a lot as a teacher is, how do I know if my child has autism? I think we see autism spectrum disorder represented a lot more, so a lot more people are aware of it now, but unfortunately that doesn't mean that everyone understands it, and particularly parents of young children often seem to be concerned about finding out if their child has the symptoms, if their child is showing symptoms, if how their child is behaving is typical of a child their age. Particularly for first-time parents, we are, myself included, always looking at our child's development. Are they developing how they should be? Are they hitting those milestones that we think they should be or that we're told that they should be? And if you've never had a child before, you haven't really got any kind of rule book to go by. Autism spectrum disorder, or ASD, of course affects adults, older children, younger children, but today we are just going to focus on younger children, kind of from birth to age 5 or 6. So what is autism spectrum disorder? According to the National Autistic Society, autism is a lifelong developmental disability which affects how people communicate and interact with the world. Being autistic or having autism spectrum disorder can result in social communication and social interaction challenges, repetitive and restrictive behaviour, over or under sensitivity to light, sound, taste or touch, highly focused interests or hobbies, extreme anxiety, and meltdowns and shutdowns. Now, I think it's really important to remember that autism spectrum disorder is a spectrum. What it means to be on the autism spectrum is that one person's autism will be different from another, to another, to another. The symptoms that someone with ASD may experience may be completely different to someone else who is diagnosed with ASD. They may have different strengths and weaknesses to each other. Just because two people have been diagnosed with ASD does not mean that their ASD is going to present in the same way. And of course, they have strengths and weaknesses in different areas, just like anyone does, even someone who doesn't have ASD. As this is a spectrum disorder, the amount of support someone with ASD might need can vary to very minimal support or no support in some areas, to all the way on the other end of the spectrum having a lot of support, full-time support, one-on-one support. So saying that someone has ASD is really not telling you a lot, it's just telling you that they are on this spectrum. Now, when it comes to very young children, there are certainly challenges in recognising ASD, and we will come on to that in a moment. Some of the most common symptoms that we see in children who are very young and have ASD are not responding to their name, avoiding eye contact, not smiling when you smile at them, getting very upset if they do not like a certain taste, smell or sound, repetitive movements such as flapping their hands, flicking their fingers or rocking their body, not talking as much as other children, not doing as much pretend play, repeating the same phrases. So you may have already noticed that many of these symptoms do just sound like a toddler who doesn't necessarily have ASD, and that is what makes it very difficult to recognise ASD in many young children. So for example, getting very upset when they experience a certain taste. Yes, that could be because they are having a sensory issue when it comes to that food, but also it could just be that they don't like that food and they don't want to be given that food, just like many, many toddlers, my own included. Not talking as much as other children, this is certainly one that so many parents worry about and come to me in consultations with. Some children do just start speaking a bit later, some children develop other skills first and then come on to their communication skills. Some children are really great at listening and understanding, but their speech just takes a little bit longer to come along. So just because your child isn't speaking as much as other children when they are younger, maybe if they are 2.5 and you think, the other 2.5-year-olds are talking a lot more than my child. That doesn't necessarily mean that they automatically are going to be diagnosed with ASD or any other kind of special need. It may just be that they're a little bit late to talking. So that again makes it very difficult to recognise and diagnose ASD in toddlers and young children, because we might just have to wait a little bit and see if those symptoms continue or if they resolve themselves and it's just due to being a child. As I've said so many times on this channel, all children develop at different rates, and yes, while we do have certain milestones that we kind of expect them to reach at around certain ages, there is not a one-size-fits-all, and some children don't completely fit into that rule book, and that's absolutely fine. Some children may not fit into this rule book and also have other challenges, and that can indicate that there might be an additional need there. Having meltdowns, again, is something that certainly with ASD we do see a lot, but also we see having tantrums or meltdowns in toddlers who are learning to develop their own ability to regulate their own emotions and to manage their own behaviour. We certainly expect toddlers and young children to have these tantrums, to have these big emotions and meltdowns, because they are really, really struggling to regulate their own emotions because of where they are in their development. However, even though sometimes we may refer to these tantrums as meltdowns, meltdowns are often even bigger, last even longer, and can be indicative of something like ASD. Now, while it is difficult to recognise ASD symptoms in very young children, it can be even more difficult in girls than in boys. Of course, this is not in every case, but in general, girls seem to be a little harder to diagnose because they are very good at masking their ASD symptoms. What this means is typically girls with ASD are able to copy the behaviour of others and to almost hide some of their autistic symptoms. They may withdraw in certain situations that they find most difficult, so then it's not as obvious that they're struggling because they've withdrawn from it completely and you don't see what their challenges are, you don't see those symptoms and signs coming up because they're not actually getting involved in that particular situation in the first place. And we also see less repetitive behaviours typically in girls with ASD, which of course, anything that is really visible, like a repetitive behaviour, is going to be noticed a lot quicker than noticing a child who has withdrawn and is maybe copying the behaviours of some other children and masking those symptoms. I thought it might be worth me just giving you my experience as a teacher in early years and what I have seen with children with ASD. Of course, I'm not a doctor, I'm not here to diagnose anyone, but this is what I have typically seen. So teaching in reception, I have seen many children who come into reception who very quickly we notice have an additional need, whether that's ASD or not, that hasn't been identified before reception because, first of all, parents may not know what to look out for, or it may not become as evident until the child is in a classroom setting with lots of other children and lots of routine and rules. It can be very, very difficult to get the support that a child needs when they get to school straight away because we need lots and lots of evidence, we need to apply for funding, and that can often take almost a whole year to do. And so children who come into reception with something like ASD, especially if they have a lot of challenges and they need a lot of support, that can be very, very difficult. I have had children who have come into my class who have no diagnosis of ASD, no support available to them, but I have noticed that there are some signs there, and when we go into it further and eventually when they have an assessment, it turns out that they do have autism spectrum disorder. So some of the things that I notice as a teacher the most are children being non-verbal or having very limited communication. Now, of course, when children come to me in reception, they are aged 4 or 5, so we would be expecting children to have a certain level of communication at that point. If children are non-verbal or have very limited communication, that does kind of make a warning light flash in my head, and I think, okay, this is a child that I need to just keep an eye on, because especially when they first start school, it might be that they're just nervous and they're not talking very much yet. So it's just something that we need to keep an eye on. Children who are not listening or appear not to listen to you or appear not to understand what you're saying to them, that is another kind of red flag for any kind of special need. These aren't specifically just for ASD. These are signs that tell me that there might be an additional need there. Any kind of repetitive behaviour or stimming. So stimming is self-stimulating behaviours, so some flapping or maybe some rocking, or maybe saying the same thing over and over again, some echolalia, which is repeating things. I once had a child who would repeat lots of sentences from Thomas the Tank Engine in exactly the same kind of tone and intonation as the narrator did in Thomas the Tank Engine. And that would be a self-stimulating and calming behaviour for that child. It would also be a way that they would use to communicate with me when they wanted to do some playing. They would manage to kind of contextualise that echolalia into whatever it was we were doing. Any child who struggles with transition or change in routine, that's certainly something I look out for. Lots of young children struggle with this, but if a child is really, having maybe a meltdown because we are now moving on to the next phase of the day, or there's been a slight change in our routine, that is something that says to me that they are really struggling with this and this is a big challenge for them. Also, difficulty playing with others. Now, this might be children kind of just playing alongside other children and not actually interacting with them, just kind of playing next to them, which is very, very typical for very young children. That is how they learn to play. By the time they get to kind of reception age, that's something that I'm looking out for. It might not be anything, it might be that they're still just learning, but it's something I look out for. And also children who withdraw and just play on their own and don't really care or want to interact with other children. Now, in this video, I've been talking a lot about the challenges that people with ASD face and young children with ASD face, and those challenges are the things that we notice to be able to recognise that that child has ASD and to be able to diagnose them with it. But children and people with ASD also have many, many strengths which are individual to them, and I don't want it to seem like having a diagnosis of ASD is just this big negative thing, because ASD just means that a child's mind works in a different way, their brain works in a different way, they interact with the world in a different way, and just because it's different to someone who doesn't have ASD doesn't mean that it's wrong. For example, you may have one person who doesn't have ASD who really wears their emotion on their face and is very outwardly emotional, and then you may have someone who has ASD and even though they are still experiencing these emotions, don't necessarily show it on their face as much. This can sometimes feel a bit disconcerting to the person who is used to showing their emotions and understanding the world through seeing other people's emotions. But just because it's different for that person doesn't mean that it's wrong for the person with ASD to not be showing their emotions as much. I hope that that makes sense, and of course that is not to say that everyone with ASD doesn't show emotions, because this is a spectrum and it's different for everyone. So if you suspect that your child may have ASD, what can you do? Depending on the age of the child, you may want to speak to your GP or family doctor to talk about the different symptoms that you're seeing, the different challenges that your child is having, and perhaps asking if there is anything that you can do. Maybe you want to get an assessment or what the next steps might be. You may wish to speak to the health visitor. If you're in the UK and a child is under 5, you can speak to your child's health visitor as well. And if your child's already in school, you can speak to the Special Educational Needs and Disabilities Coordinator, who will be able to advise you further on what to do. Getting a diagnosis of ASD for a young child can be extremely helpful if they need support when they go to school, but it also can be very helpful for a child as they grow up to know and understand themselves, to understand how their mind works, and that it might be slightly different to what most of the population is used to. I personally know people who have been diagnosed with ASD or something like ADHD or another additional need later on in life who wish that they had been diagnosed earlier, because it would have helped them to understand why things seemed a bit different for them, why things seemed to be a bit more challenging for them, and if they had known and had this diagnosis earlier, they would have been able to access particular support to make things easier for them. So I hope this video has been helpful. Please leave any questions or comments in the comment section down below. If I can't answer a question, then I will give you some information of where you can find your answer, and in the description box down below I will put some resources as well for you to look at to better understand ASD. If you have ASD yourself, I would love to hear from you. Were you diagnosed younger? Did you show the symptoms that we usually think are typical of children with ASD? Were you diagnosed later? Do you wish you were diagnosed younger? I would love to hear from you. It's very important whenever we talk about any kind of condition or disability that we hear from the people who actually have that condition or disability. So I would love to hear from you. And if you did find this video helpful, please give it a like, as it really, really, really helps out the channel. And don't forget to subscribe so you can see more videos just like this. Thank you so much for watching, and I will see you next time.